Well, many Republicans promising voters that they will repeal Obamacare, but that leaves the question of what would happen next. Jim Engel takes a look at what Republicans have planned.
The choice is to go forward or to be dragged backwards.
Democrats argue Republicans who want to repeal the Obama plan want to return to the bad old days of health insurance.
Put politics behind us. Join with us in ensuring that every American has access to quality, affordable care, that no person is denied coverage due to a pre-existing condition.
Republicans, however, say they agree the old system will not work.
The healthcare system, the status quo, is unacceptable. As a physician, I can tell you that it doesn't work for patients. It certainly doesn't work for doctors.
One conservative analyst says Republicans should now lay out their plans to show people what they would do.
They need to be able to talk about a health care vision that is different from Obamacare vision. And they need to be able to announce some principles that people can understand and agree with.
All the Obama administration and the people that supported the president's health care reform did was add more people to a failed system or a failing system. That's not health care reform.
People always rejected the individual mandate in polls, but another aspect was consistently and immensely popular: coverage of pre-existing conditions. In fact, one poll found that 85% favored that, with only 12% opposing. Republicans have several plans to cover pre-existing conditions. One reason for the mandate was to force lots of healthy people into insurance pools to spread the risk. Republicans say they can do that without the mandate, which they plan to repeal.
You get the pools large enough to be able to make it so that pre-existing illnesses don't make any difference to the cost of health coverage for folks.
Because the risk is spread over such a large group that expensive illnesses of a few don't drive up premiums for all. If it's that simple, though, why hasn't it been done before? As it turns out, if you don't work for a large multi-state employer, it's illegal for individuals or small groups to buy health insurance across state lines, even though you can buy auto or life insurance anywhere.
Well, I often jokingly say that isn't it interesting you can buy car insurance from a lizard across state lines, but you can't buy health insurance.
Republicans would change that law so that people who belong to the same associations, such as all realtors, or all Lutherans, or all small business associations, could form a pool for health insurance.
What if we allowed everybody who was a member of a civic organization, Kiwanis Club or Rotarians or Lions Club, to pool together to purchase insurance? Then you get the purchasing power of millions.
Congressman Rehberg once proposed allowing anyone anywhere to join the federal health plan, which has 9 million members all over the U.S.
They have different kinds of insurance plans that they can pick from, and that's what we would like to do. Is we'd like to create bigger pools.
Republicans have several bills already written and ready to go. Most have one thing in common: there would be no mandate and no tax increases, and the federal government would not be making health care decisions, they say. Patients and doctors would. Heather?
Jim Engel, thank you so much.